I have appropriate PPE for myself and my team. Are there any environmental safety hazards?
The scene is safe.
Number of patients?
1.
Mechanism of injury and nature of illness?
You're called for a patient experiencing shortness of breath.
I'm going to request for ALS. I don't think there's a need for C-spine, but I'm going to reassess when I get in there. What's my general impression of this patient?
The patient is conscious, pale, with slightly labored respirations.
So my general impression of this patient is poor. Hi, my name is Emma. I'm going to be your EMT today. What's your name?
My name's Mr. Smith.
Hi, Mr. Smith. Is it okay if I check you out?
Yes.
All right, so what's the problem?
I'm having some shortness of breath.
Okay, so my patient is having shortness of breath, which is a life threat, and his airway is patent. All right, Mr. Smith, I'm going to go ahead and check you out a little bit. Is that okay?
Yes.
All right, so checking his breathing, rate, rhythm, and quality.
The rate is approximately 20. The rhythm is regular and it's slightly labored.
What's his pulse ox?
His pulse ox is 89.
I'm going to go ahead and start him on a nasal cannula, starting at 4 liters per minute. Do I see any major bleeding?
No.
Okay, I'm going to check his pulse. What do I feel?
You have strong, rapid radial pulses.
Okay, what's his skin, color, temperature, and condition?
His skin is pale, warm, and dry.
So I'm going to make this a priority patient. We're going to go code 3 to the hospital with an ALS intercept on the way. All right, Mr. Smith, I'm going to ask you a few questions. So what were you doing when this happened?
I was mowing the lawn.
Okay, does anything make this better or worse?
No.
Can you describe to me like what you're feeling?
I'm just having some tightness in my chest.
Does it move anywhere?
No.
And then on a scale of 1 to 10, 1, you can breathe totally fine, and then 10, this is the worst day of your life. What would you rate this?
I'd say it's about a 4 today.
And then how long ago did you say this started?
I'd say it started about 25 minutes ago.
Okay, are you on any medications?
I take albuterol, but I ran out, and that's why I called you.
Have you been intubated before?
I have, yes.
Okay. Do you have any allergies to anything?
No allergies.
And you said this has happened to you before?
Yes, it has.
When's the last time you ate or drank something?
I had lunch about an hour ago.
And you said that you were mowing the lawn?
Yes.
Okay, so I'm going to go ahead and take your vitals now. Is that okay?
Yes.
All right, so I'm going to check his, oops. Oh, no, Bear, you stay right there. I'm going to go ahead and assess his lung sounds. What do I hear?
You have expiratory wheezes.
Okay. Oh, my goodness gracious. His pulse?
His pulse is approximately 110, strong and regular at the radial artery.
Okay, and then his blood pressure?
His blood pressure is 148 over 84.
All right, and then his eyes?
His pupils are equal, round, and react to light.
And then one more time, his skin signs?
His skin signs are pale, warm, and dry.
Okay, so I'm going to go ahead and reassess this patient every 5 minutes. Like I said, we're going to go code 3 to the ambulance. We're going to transport this patient make him as comfortable as possible. But first, we're going to do a physical examination.
Okay.
Yeah, okay. Okay, so make him as comfortable as possible. When we're transporting him, we're going to loosen any restrictive clothing. And then when we meet up with ALS before we arrive to the hospital, I'm going to give them a full oral report on the patient. Then when we arrive to the hospital, I will give a full oral report to any of the staff that may be treating my patient.